malaria season in northern Uganda. When the rains come, the mosquitoes breed again, with deadly effect.
And this is high season, malaria season, rainy season. Right after it rains, after the incubation period, 7 to 14 days, the hospital's full of kids with malaria. Okay.
Every day, malaria kills at least 300 people in Uganda, mostly pregnant women and children under 5. That's well over 100,000 deaths a year. But with the correct protective measures and modern drugs, the disease is entirely preventable and curable. The use of bed nets sprayed with insecticide prevents mosquitoes transmitting the disease. And early spraying of dwellings before the season gets underway gives further protection. But a group of drugs, known as ACTs, can provide a complete cure if administered correctly and in good time. In Uganda, however, the ACTs are not getting through to the people who need them. The drugs are supposed to be available free at government hospitals and health centres in Uganda. But now a growing black market ensures that the valuable ACTs are available only to those who can afford them. Those who cannot are often given the wrong treatment. Joyce works for a Ugandan aid agency, teaching villagers how to purify water from the local well. When her son Innocent fell ill, she took him to a local pharmacy. Joyce did not have enough money for ACTs, so the pharmacist prescribed an old-line malaria drug. This made the condition worse.
So Innocent or Clown?
Luckily for Joyce, she lives close to a health centre where ACTs are available free, thanks to support from Médecins Sans Frontières.
This is a 1 year, 1 month old who was given some anti-malarial medicine out in the village and some paracetamol. Kid was vomiting, didn't quite take all the medicine, came in here. The impression was severe malaria.
Innocent was lucky. He eventually got the right treatment. Throughout the village lie the makeshift graves of children who weren't so fortunate. Kojo Edo is Médecins Sans Frontières' head of mission in Uganda. With cases of malaria on the rise, he's decided to investigate why government supplies of ACTs are going missing. He heads towards Kitgum in the north of the country to assess the situation for himself.
I know that the supply of these drugs is erratic and is not available in the health facilities. So I want to find out what is the problem, why this drug is not delivered to people.
At the first public health centre he visits, he finds that deliveries of Coartem, the best-known ACT purchased by the government, have ceased.
What we are using is now Fansidar.
Instead, patients are being given Fansidar, also known as Orodar, an old-line treatment to which many strains of malaria are now resistant.
So this is the only thing we are left with.
By contrast, a private clinic in the town of Kitgum has no problem securing supplies of ACTs.
I just make my phone call and then my friend in Gulu, they put it in the taxi and in about 4 hours I get my drugs.
Kojo's worst fears about Coartem supplies have been realised.
It's going beyond frustration. It's shocking. It's something that needed to be solved immediately.
According to some estimates, as much as 75% of Uganda's ACT supplies, which should be available free, are being diverted onto the black market. Many more lives could and should be being saved.
Okay, UA? UA Matek? Okay. Malaria is a potentially preventable and treatable disease, so it seems quite ridiculous that all these sick kids are populating the hospital. Hey!
These patients could be cured. Uganda has sufficient supplies of ACTs, but hundreds of Ugandans are still dying of malaria every day. Proper auditing to improve the supply chain of ACTs is essential to prevent the unnecessary deaths of so many pregnant women and children under 5. Unless or until action is taken to make the drugs freely available, malaria will continue to exact its deadly toll.
I've seen about 1 kid a week die since I've been here. I don't think you ever really get used to that. I don't think you ever really get used to that one.